Alright, our next lecture is going to be looking at the Fisher's exact test, which is another statistical test that we use for nominal data. When we pull up our decision tree diagram here, we can see that we use a Fisher's exact test when we have two groups of nominal data that's unpaired. And when we're deciding between using a chi-square and a Fisher's exact test, we look at the expected count. So this would be those expected frequencies that we calculated back in the chi-square lecture. And we would use the Fisher's exact if we had an expected count of greater than or equal to 5 in less than 80% of the cells. And so we'll get into this a little bit more when we go through the lecture what this exactly means. Our objective, as always, is to appraise if the specific Fisher's exact test can be used for analyzing data provided in a scientific journal, or if it was appropriate for use in analyzing data provided in a scientific journal. So like I mentioned before, the Fisher's exact test is used for nominal data. However, it is used in the following cases. So it can be used when total number of patients is small, so less than 20, with a 2x2 matrix. Or it can be used if we have more than 20 subjects, but the expected cell count is 5 or greater in less than 80% of the cells. The other 5 assumptions of the chi-square still apply. The calculation of the Fisher's exact test involves a direct calculation of the probability p for a one-tailed test. However, most of the online statistical calculators will give you a two-tailed option, and that's what we're going to be using today. It's important to keep in mind that if one were to be calculating this by hand, since the distribution of probabilities of data matrices is usually not symmetric, it's kind of considered controversial whether it is appropriate to double the calculated p-value when the test is two-tailed if you're calculating it for a one-tailed. There's also some controversy too that the Fisher's exact test is on the conservative side as well, but it is important to be able to differentiate between when you should maybe use it compared to a chi-square test, and so I'll give you an example of that. So again, you are a clinical pharmacist working in an outpatient pain clinic, and you're interested in assessing, based on gender, the distribution of patients you have that are on pain medication A versus pain medication B. So again, we have our two rows here, one for male, one for female, and we're looking at associations between specific pain medication use and gender assignment here. So we have pain medication A in the first column here and pain medication B in the second column here. So to begin with, we want to make sure that no assumptions are violated. So kind of the two that we look at for Fisher's exact are right here. So total number of patients is less than 20 with a 2x2 matrix. So we have 22 patients here, so this isn't the case. Or we have an n greater than 20. That's what we have here. But the expected cell count is 5 or greater in less than 80% of the cells. Here I've put the expected frequencies that I've calculated in brackets in red here, and we calculate these expected frequencies in the same way that we do for the chi-square. So we can see we have an expected frequency of 6.5 here, that's greater than 5. We have 9.5 here, that's greater than 5, but the other two are less than 5. So that means that we have a cell count of 5 or greater in only 50% of the cells. So we would use the Fisher's exact in this case. If they were all greater than 5, then perhaps we should be using the chi-square. We want to state the null and alternative hypothesis. So the null hypothesis is that there is no association between patient gender and pain medication used. The alternative is that there is an association between patient gender and pain medication used. We want to state the alpha, which is 0.05. And in the case of the Fisher's exact test, we don't calculate a degrees of freedom, and we don't need to find a critical chi-square value because the Fisher's exact test allows us to calculate our probability value directly. And for this, we're going to use a statistical program. Okay, so I've pulled it up here, and we just enter our values in the 4 cells here, which I've already done. Okay, and we want to use a Fisher's exact. And we want to do a two-tailed as well. And then we hit calculate. And like I mentioned before, for the Fisher's exact, it directly calculates a p-value. So our two-tailed p-value is equal to 1. And so this is greater than 0.05. And so this means there is no association between gender and medication use. And so it's considered to not be statistically significant. So again, since our p-value is equal to 1, which is greater than 0.05, there is not a statistically significant association between gender and pain medication used. In our next set of lectures, we're going to look at the McNamara and Cochrane Q test.